Clinical Reasoning in Internal Medicine. Case 1. A 56-year-old man comes to the emergency room complaining of chest discomfort. He describes the discomfort as a severe retrosternal pressure sensation that had awakened him from sleep 3 hours earlier. He previously had been well but has a medical history of hypercholesterolemia and a 40-pack per year history of smoking. On examination, he appears uncomfortable and diaphoretic, with a heart rate of 116 bpm, blood pressure 166/102 mmHg, respiratory rate 22 breaths per minute, and oxygen saturation of 96% on room air. Jugular venous pressure appears normal. Auscultation of the chest reveals clear lung fields, a regular rhythm with an S4 gallop, and no murmurs or rubs. A chest radiograph shows clear lungs and a normal cardiac silhouette. The ECG of this patient is shown here. What is the most likely diagnosis? What is the next step in therapy? Let's see the key points of this scenario. This is a 56-year-old man with risk factors for coronary atherosclerosis, smoking and hypercholesterolemia, who has chest pain typical of cardiac ischemia, that is, retrosternal pressure sensation. Cardiac examination reveals an S4 gallop, which may be seen with myocardial ischemia because of relative noncompliance of the ischemic heart, as well as hypertension, tachycardia, and diaphoresis, which all may represent sympathetic activation. Most likely diagnosis: acute ST segment elevation MI. The duration of the pain and the electrocardiographic ECG findings suggest an acute myocardial infarction MI. Next step in therapy: administer aspirin and a beta blocker. Assess whether he is a candidate for rapid reperfusion of the myocardium, that is, treatment with thrombolytics or percutaneous coronary intervention. Note the following for this patient. 1. Know the diagnostic criteria for acute MI. 2. Know which patients should receive thrombolytics or undergo percutaneous coronary intervention, which may reduce mortality. 3. Be familiar with the complications of MI and their treatment options. 4. Understand post-MI risk stratification and secondary prevention strategies. Considerations. The 3 most important issues for this patient are: 1. The suspicion of acute MI based on the clinical and ECG findings. 2. Deciding whether the patient has indications or contraindications for thrombolytics or primary percutaneous coronary intervention. 3. Excluding other diagnoses that might mimic acute MI but would not benefit or which might be worsened by anticoagulation or thrombolysis, e.g., acute pericarditis, aortic dissection.